Certainly we're incredibly concerned at UNAIDS and I think across the UN family that we still have over 300,000 deaths among women with cervical cancer every year. So number one, just a very overall health burden that is happening because we haven't conquered cervical cancer is of concern. But for women living with HIV, it's an even bigger concern. Women who are living with HIV are 5 times as likely as women who don't have HIV to develop invasive cervical cancer.
Very often they develop cervical cancer at much younger ages. It develops much faster to aggressive stages.
There's 600,000 cases a year at the moment globally. That's going to grow to 1 million within the next couple of decades if nothing is done.
The reality is we're not where we need to be in terms of even access to basic screening and early treatment.
It's also an issue of gender and social equity, because we know that the poorest women are most vulnerable. If you look at the linkage between HIV and cervical cancer, is mostly Eastern and Southern Africa.
Women who are living with HIV in Zambia as well are 5, sometimes even up to 7 times likely to develop cancer of the cervix. We end up losing a woman from a preventable disease. We end up having lost a woman who has consistently taken her medication because we didn't prevent her from getting cancer of the cervix.
And in Ghana, at least, we know that 2 out of 3 cervical cancer patients that present, within a year they die.
Young women and girls in wealthy countries, 90% of them now have access to HPV vaccination, and only 10% of young women in lower middle income countries have access to that. So these are huge inequities already.
It's a cancer that we can prevent, it's a cancer we can screen for, it's a cancer we can treat. It's a cancer that causes more than 300,000 deaths of women around the world. We know that those deaths are often accompanied by families being dragged into poverty, by families not having someone to put bread on the table, someone to take care of the children or the older relatives. So we know that there's a tremendous burden.
It's incredibly important that screening takes place on a regular basis, especially for women who are living with HIV.
And I think we can't forget and we can't underestimate how tragic it is for anyone to be suffering from and dying from cervical cancer in this day and age. We know how to prevent most cervical cancer now with the HPV anti-cancer vaccine. We know that if cervical cancer changes are caught early, the treatments are very simple. And we also know if we have treatment available and we're caught early, even with invasive cervical cancer, women can be very successful in their treatment. When that's not happening, for all these layers of missed opportunities, families suffer, women suffer, communities suffer, and it's just really horrible. I think this issue that 2 diseases, 1 response is a very powerful one. This is such an intensive, urgent need to bring the response to these diseases where they overlap together. We have to bring not just the service responses together, but the political will together and the advocacy communities together.
If we can achieve successful scale-up of HPV cervical screening and vaccination, the estimates that we've done here at Cancer Council New South Wales suggest that we could prevent up to 13 million cervical cancer cases in the next 50 years.
We have the tools, but we call on governments of all persuasions to take those tools and implement them with full commitment.
If we had a successful immunisation programme, we could not only prevent the cancers, but eventually eliminate the virus entirely. The challenge, of course, is to get universal immunisation. There needs to be a global initiative to get rid of papillomavirus infection. It needs to start from the top, start from the World Health Organization that are very keen to achieve this. It then needs to flow down through the aid agencies.
We have vaccines to prevent it. We have diagnostics to detect it as early as possible. And we have a treatment at hand. 1 woman dies every 2 minutes. This is really tragic, and this should not happen, especially when we have all the weapons we need to fight it.
The fact that we have an HPV vaccine, an anti-cancer vaccine essentially, means that in a generation we could be in a fundamentally different place than we are right now.
So we've seen it in Rwanda, which is a low-income country, where they were able to roll out a vaccination of more than 90% of schoolgirls.
Do I think we should be talking elimination every place in the world? Yeah, I do. And the question is, how's the world going to step up to meet that need?